Good evening, everyone. I have today with me a special guest. So, today's topic is about mental health, raising awareness for mental health. It's Mental Health Week Awareness, hashtag mental health, World Mental Health Day. So, today, mental health is a big topic. So, if you're having mental health problems, you're not alone. That's what we want to say to you. 1 in 4 of us will have problem with our mental health at some time in our lives. So today I have with me Shaista. Thank you very much for joining me tonight on a Saturday evening. And it's lovely to have you. So Shaista is from a family law background. Family law is involved in family law. Made changes into the parliamentary work. Works with the ministers and the president of family division, and represents the family justice system and its operations, and has made awareness of mental health within family law, as well as many related topics that influences this country. Also manage a life development club for children, young people and parents, and also have a degree in psychology. Wow. Amazing. She's so young. Look at that, all those achievements. It's all about motivation and passion that you have, I think, so Shaista.
Well, I think you do as well. You, of course. So, it's vice versa. So, thank you, and it's a pleasure to be here.
So, today, because it's Mental Health Awareness Week, what is your definition of mental health?
Mental health is a very broad subject, and one of the most things I stress about at all times is the terminology and the definition of the word itself, mental health. And my beliefs are that it should be called something along the lines of, or actually, emotional health well-being. Mm-hmm. And as I said, if I said are you mental? Of course.
Yeah.
It's not the response in the kind of question that you can actually go around asking people, and it's very intimidating, it's very embarrassing. And actually, mental health, it's not your mental, it has a lot of other things that are not, the stigma around it, that it could not fall into it.
So can you give us like a few examples, please?
Sure. Mental health affects people, physically, emotionally, intellectually, and socially. And again, in one's aspect, it could have a huge amount of effects, and also signs that you can find out from the early ons from it. Some of the signs that obviously it can lead on from or prone from is such as loneliness. It could be from sadness. It could be from anxiety, fear. Extreme low levels of self-esteem, confidence. It could be disorders such as ADHD, sleeping disorder, eating disorder.
Yeah, eat less, eat more. Yeah,
absolutely.
Gain weight, lose weight.
Absolutely.
Restless.
Yep.
Concentration levels are low sometimes.
Yes.
So there's a lot of things that we can talk about relating this topic. So where are they? So what else can you give us? What more examples can you give us?
It could also include parental separation. So the parents can be affected, the children can be affected. It could affect somebody who's subject to child abuse, or a person who's subject to discrimination. It could involve, in family law cases, child neglect. It can affect the child. It could be that a parent is or somebody, it doesn't have to be a parent, anybody, it could be under the influence of alcohol and substance abuse, and it could be somebody who has self-harm feelings, suicide feelings. It could be somebody who feels unworthy, very guilty. Could be someone who's a victim of bullying. It's a big range, and again, it could affect many people and many ages of lifespan development.
So yeah, you're saying, as you said, so as well coping with bereavement, financial problems and relationships, children as well, raising awareness with children, being able to talk to the children and see what how they're feeling, low self-esteem. So it's a big topic. I mean, there's resources people can find as well, like Young Minds, a charity, probably the NHS Choices. We can direct them to well-being prescriptions as well in Surrey area where we are. So there's too many help there, but all you have to do is access your healthcare professionals, go there, talk to them, pharmacists, GPs. There is help there, so go and have that help. We're here to support you.
Absolutely.
Just talk about it with people who of course you're feeling comfortable to. It might not be your family, it might be someone
else.
So that's what we're aiming for. So any steamed from this, well, what can you?
Yep. In answer to that, and I think the other one is that sometimes people find it much more better to approach someone who's not part of the family and who's outside of the family, and again who doesn't know anything about you. So again, such as a counsellor who can be involved, a cognitive psychologist, a behavioural psychologist, CBT. Yeah. It could be play therapy and other ways that. You can also be helped by this. And again, as Hada said, the access is available there. It's just you have to, find ways to approach it. And again, people as such, it's a big area, and some of the people don't even know what help there is available in that. A lot of times it could be stemming from a physical illness that one may have. It could have been they may have had a physical illness in the past or currently going through one. It could be someone who, again, in my list I've got bereavement, somebody who has lost a family member or someone who has been close to them. It could be a family friend, it could be anyone. And again, the effects of that is quite very traumatizing to a lot of people. The other kind of aspects I'm thinking of is parents with mental health issues, or parents again who are splitting up in divorce and separations. It could affect anyone who's going through poverty, a young child who's taking adult responsibility at a young age, again in the family law remit, one who's as I mentioned earlier, alcohol and drug misuse. There's many more examples to the ones I just spoke about. And again, we need to address this issue.
Do you have some statistics with you, some updates you would like to share with us as well, Shaista?
Yes, I do. I've got a few, and I'm sure that there's many more statistics there that we can cover. But one of the ones that I found from the Mental Health Foundation, who have done some research, and they found that 70 million people are off work due to mental health illness, and that's including stress, depression, and anxiety.
So 70 million?
70 million people.
Wow.
A big number, and that the illness reason to be having that time off is related to this. So we must be helping these people. And globally, looking at 615 million people around the world and this is just what we have found. There's many more suffering from depression, and we have there's been some research in 1 in 10 children affected, and potentially many more. The Ofsted and Care Quality Commission have got involved, and also have stated a comment that to get onto the government and make it more mandatory to require mental health services to collect data on this, because they have found that there's been issues in the past where adult social services and children's social services haven't connected together. This was in the past, but again, it's about professionals working together, such as pharmacy and family law.
So what sort of concerns do you want to talk about today? Some concerns that we have.
I think we have to do something about this matter. That's very important. This is just my personal concern that I feel that we must also address. And I think in terms of, people approaching this help, but it being negatively used against them. And I know of some people that obviously have the fear that this will be negatively used against them, although it's a service that we're trying to promote helping. And I think one of the things, it could be that, for example, in family law cases, mental health can be used against you in preventing your rights with children. So I think it's about working together and working with someone who has, whether it's minor mental health issues or severe mental health issues. And again, like I said, the terminology should be emotional health and well-being, and not mental health because it's kind of more rotated from the psychological perspective of the mental process of the brain, but not everybody has studied psychology. So we have to bear in mind that the language used is transferable and understandable and appropriate.
Yeah. So this is just today a basic introduction about me and Shaista coming together. It's amazing to have you tonight and talk about this awareness week for mental health. If you would like to join us and put all your views, negative, positive, neutral,
any criticism,
any criticism,
views,
we're happy to
positive
hear.
and negative. This is about working together, isn't it, really?
And you can write it on the bottom of this video, or if you don't feel you want to be, you don't want to share it
anonymous
to the public, show it anonymously to us, either send it to me or to Shaista. And basically we're looking for more collaboration on this topic. We want to take it further and further. The more people join us from any sector, from the public, we're happy to work together to improve mental illness.
Yes, absolutely.
So thank you very much. Have a lovely evening. Bye.